So testing has improved within Ontario and KFL&A. The capacity's improved. The turnaround time has improved as of October 15th, 2020. So that's really good news. We've been asked a fair number of questions just to clarify, where should I go if I have symptoms or don't have symptoms, and what are my options? So you can go to covid-19.ontario.ca. It's a great website. You can screen for your symptoms on that website to see if you've got symptoms compatible with COVID-19. You can also put in your postal code. It'll tell you where testing is available within your jurisdiction. If you are going to go for testing, please bring your health card, bring a pen, and all appointments for any testing for COVID-19 are booked. And that's going to facilitate you getting in and out, and I've heard it's down to 20 minutes at our booked appointment sites, so that's brilliant. And will be minimal lineups, so physical distancing will be maintained, and they've really straightened up any issues that they've had in the past, and I think the system's working much more effectively now. As well, I've heard the turnaround time for lab tests is shortened down to 2 days or less. So the system's working better than it did at the beginning of the month. The assessments are quicker, the booking's more patient-centric, and the turnaround time of the labs is improving. So congratulations to everyone that's been working on this strategy. I do believe it's getting better. But it's very important, if you've got symptoms of COVID-19, so you've got a fever, a cough, increasing shortness of breath, loss of taste or smell, or you've been deemed to be a high-risk contact, and public health would tell you if you're a high-risk contact, you really should be going to one of our 2 assessment centers. We have one at Lennox and Addington Community General Hospital and one at Beach Grove, which is at 51 Heeks Lane, operated by Kingston Health Sciences Centre. These are their phone numbers, but they're online and clearly can be found on this website, and you can book the appointments through this website through links as well. So if you've got symptoms and or a high-risk contact, your only option is to go to the assessment center. You will be offered a test. You will be offered to be assessed by a family doctor. If your results are positive, public health contacts you very rapidly, often shorter than 24 hours. If your test is negative and you're not a high-risk contact, then you can follow the general instructions on that. If you're a high-risk contact, though, you've been asked to isolate for 14 days, and we'll be following you at Public Health for those 14 days. If you are healthy, so that basically means you've got absolutely no symptoms, you've got 2 options. One, if you're required, even though you're healthy, to get a swab for work, so you work in a long-term care facility, a retirement home, corrections facility, or you want to visit a high-risk setting, one option now available in KFL&A is that you can call a pharmacist, and there are 2 pharmacies that are offering testing right now. You can find their locations and their booking appointment method at covid-19.ontario.ca. Another option is if you're healthy, there is a separate line at assessment centers to rapidly triage you and test you at both sites for those without symptoms, so healthy. So now, if you have these 2 options, a local pharmacist and or your assessment center if you're healthy but you require the testing for work or visit.